Hi again. Okay, we're going to talk about the internal work. When we developed these skills in the early 1970s, the childbirth preparation of that day was Lamaze and Bradley. Some of those techniques and skills worked, but like anything that's new, everything can evolve, and birthing better was a huge evolution of birth skills. Sadly, the natural birth movement felt that skills should only be used for low-risk, normal pregnancies and birth in order to achieve three goals: natural birth, pain-free labor with no medical care. That left out the vast majority of women, most of whom were delighted that they lived in modern countries and wanted to have medical care. They wanted to reduce the risks. And that's why a lot of the medical care has gotten more sophisticated, because we as consumers wanted the risks reduced. We didn't want our breech babies to die or get hung up. We didn't want our twins to die. If we had gestational diabetes, we didn't want our baby to have a problem, and on and on and on and on. We want to have a great birth, but more importantly, we want to have a safe birth. And one of the ways that birth gets more complicated is that long first and second stage. And that's why Birthing Better families developed all the body skills, and they developed the internal work, because the baby has to come down through soft tissue at the end. And if that soft tissue is tight, the natural birth movement says, let women naturally stretch. You don't want that. You want to open up. You don't want to be pushing for hours. Your baby wants to be born. And it's desperate to be born at that point, because it needs to breathe at a certain point. You certainly hear, well, as long as the cord's attached, babies are fine. Yes and no. Baby wants to be born, and your job is to make it easier for your baby to come out of your body. And so you need to do the internal work. On this audio, and remember, go back to the Pink Kit book that's in the body skills to see the illustration. You, as a birth coach, will learn how to do the internal work on your partner. 5 minutes a day from 32 weeks. Can you put aside the time? You don't want her body damaged. You don't want your baby delayed. And learning how to prepare the inside of a woman's body helps you understand this big object that has to move down through and out. Her belly's getting bigger. What do you think is filling it? And how do you think it's going to get out? It's not like it's big in the belly and then somehow becomes the width of a pencil, and then as it pops out, it just sort of like balloons up into a head. That head, that grapefruit, has to come down through her body. So your job is to help soften the tension that's inside. Now, a lot of men are sitting there thinking, but I like that she's tight. She'll get tight again after the birth hormones go away. Your job as a man is to shift from seeing her body as a sexual object to seeing her body as what houses your baby. And you want to protect her body and your baby. So do the internal work. And you won't be frightened of women's bodies. You'll understand it. And you'll be able to check where the baby is as well. And this is thrilling to men. A lot of men would like to be pregnant. They just don't want to do the labor. And for women, get over the yuck. Really, honestly. You think, do the internal work. Yeah, do the internal work. You wipe yourself front to back. You have your period. Men come inside you. You lose your tampons. You get yeast infections. You get bladder infections. Get over it. So you want to prepare your body, and the second part of this audio teaches you how to do it. The ultra-Orthodox Jewish community, the men don't help because that's their cultural, religious viewpoint. The women do, and you'll learn how to do it. And when that baby is coming down through your birth canal, you know right away, did you do enough homework? 5 minutes a day. 5 minutes a day. That can stop your baby from being delayed. It can stop you from having a lifetime of damage in your vagina, because women who tear or are cut badly or stretch badly can have pain having sex. You can pee every time you cough or run or laugh. You have to protect your own body, so you have to do it. It's as simple as that. And you'll feel incredibly empowered after the birth for saying, I did my homework well. And you'll do it the next time as well. Bye-bye.